lot of distress, a lot of embarrassment. Her daily activities was severely affected.
It's not easy dealing with this as a 19-year-old.
كان عندها شوي صعوبة بالحركة، كان عندها صعوبة بالإيد، كانوا إجريها شوي يكونوا عم بلفوا لجوا.
Carmen is suffering from an extremely rare condition.
Everything that she had to do in her daily life was difficult because of this dystonia.
It was a terrible shock.
Carmen is a very bright, motivated, and extremely brave student. She developed symptoms of hand tightness in her left hand. She was having difficulty doing her daily activities. She was in a lot of distress, a lot of embarrassment. Her daily activities was severely affected.
Everything was going well until September 2019, when my daughter turned 18. So we noticed that she has a problem using her left hand, and also she started also to lose her balance and having like a freezing gait.
When we first saw Carmen, she was very depressed, had a lot of limitations. Because of the upper extremity dystonia, she had a hard time doing a lot of things in her daily life. She had a hard time with writing, she had a hard time with things like brushing her hair, showering, getting dressed, just because of those dystonic tremors.
A lot of hope, she came to Cleveland Clinic Abu Dhabi. She was diagnosed with this condition called dystonia, where we see the neurological symptoms of hand twisting and tightness.
Additionally, when she came, she had a lot of weakness, so we had to work on a lot of those challenges in order to provide to her the best therapy and the best quality of life after therapy possible.
We addressed directly to Dr. Shivam Mittal, and he did the first diagnostic. So he found that our daughter unfortunately has a neurological problem. It's a syndrome called Haller-Worden-Spatz. This one is giving her a problem with the hand called dystonia, so she cannot control her hand because of some wrong impulses from the brain.
Dystonia is a neurological condition, is a movement disorder where you see turning and twisting of the muscles. Dystonia can affect different parts of the body. When it affects the neck, it is called cervical dystonia. When it affects the eyes, it causes blepharospasm. The different medical terms that doctors use to describe dystonia. So, Carmen, this is an example of a hand, and we have more than 20 muscles in one upper limb. There are different muscles which can contract, which can become tight. As a result, you have posturing in the hand, which we call as dystonia. We use EMG where we find the muscle exactly, and we can go deep inside the muscle and find the muscle, isolate the muscle, and inject botulism toxin injection. And when it is done precisely, it works very well. Okay?
Because the dystonia was in her left hand, so she still had a lot of difficulties doing her activities of daily living. So simple things like brushing her hair would be difficult, taking a shower, putting her jacket on, putting her clothes on. Everything that she had to do in her daily life was difficult because of this dystonia.
Dystonia is an extremely rare neurological condition. When we look at the movement disorders, which is a group of neurological condition, the most common condition we see is Parkinson's disease. Other condition is essential tremor. And third most common on the list is dystonia. Dystonia we subgroup as there is a cause or there's a genetic reason for dystonia, or there is a secondary cause for the dystonia.
For us, it was a shock, a real shock. So we tried and managed to overcome our initial shock and pain, and explained to her that with treatment she can still have her dream come true, but she has to be positive and just overcome everything.
When Carmen came to Cleveland Clinic Abu Dhabi, I went through the entire history, examination, and able to diagnose that she is suffering from this rare condition called dystonia. Now, when we look at dystonia, we have to find out what's the reason for dystonia. She had MRI testing, and we found a very specific pattern that we see in a genetic condition causing this condition of dystonia.
So when we see a patient with dystonia like her, we discuss all the patients in our multidisciplinary team meeting to check what age it started, how the symptoms are progressing, what are other symptoms are there, what all the body parts are affected, how it is affecting her daily life, whether she is responding to medicine or the injections. Out of all patients, about 15 to 20% of the patients may need a surgical intervention when mostly they are not responding to medication or botulism toxin.
It is very important that we consider patient in the center, and we should have a surrounding team with a multidisciplinary team approach, including occupational therapist, physical therapist, physical medicine and rehabilitation specialist, and also requiring neurosurgeon if we need to.
For Carmen, you know, things like gaining her strength to be able to do all her activities of daily living was something that was important. So we had to develop a specific, patient-specific plan that was fit for her.
This botulism toxin is a very powerful medication which, injected in the right dose, in the right muscles, using sophisticated technique like the electromyography, EMG machine, we can find out the right muscle and we can improve the symptoms very well.
Luckily, Carmen is that kind of girl that she smiles all the time. She's over positive. Very rarely you can see her upset or not smiling. So she understood her situation, and she said that yes, I will fight with this disease. She will not put me down.
قدرنا من خلال هذا الشيء نحط خطة للعلاج بتكون هي عم بتجاوب على كل الضعفات الموجودين عند المريضة لحتى تكون عم تسترجع حركتها بطريقة طبيعية. أول ما اجت لعنا كان عندها شوي صعوبة بالحركة، كان عندها صعوبة بالإيد، كانوا إجريها شوي يكونوا عم بلفوا لجوا، وكان عندها شوي صعوبة بالمشي. I'm gonna ask you to remove your hands. Keep your balance straight. All right. Shiver. Keep your balance straight. Very good. Very good. All right, all right, all right. Okay. Okay. Let's do that again. Remove your hands. Very good. Keep your balance straight.
Carmen always discussed feeling self-conscious about her condition. Going to school, she felt that she wasn't normal like her other classmates were because of those dystonic patterns that she was having. So we kind of also had to work through that to make sure that she felt normal like every other 19-year-old would.
From our side, we discuss all these patients in a multidisciplinary team meeting where everybody chips in, they gives their ideas to make every part of her life, not only her symptoms, her daily life, how she is working in her sleep, how is her sleep, how is her daily activities, how is her mood. The quality of life is very important.
Thanks to the whole team of doctors from Cleveland Clinic Abu Dhabi, Carmen now is like another person. If you should have seen her 3 years ago, her movements were very disruptive.
After several sessions, Carmen showed great improvement. She was very diligent and consistent with therapy, and that helped us out a lot throughout the way. She was able to reach most of her goals in very little time, so I knew that she was doing a lot of work also outside of therapy.
Okay, keep your hands on your chest. I'm gonna put this here. I'm gonna keep on holding you from the back. I want you to step forward. Yes, one time with the right and one time with the left. Keep your balance, brace your core, very good. Again, slower and go as far as you can. Very good. هلا صارت كثير احسن، قدرنا نحن وياها نوصل للنتيجه يلي هي كمان بدها اياها ويلي هي كمان بتتمناها من خلال شيء بنسميه multidisciplinary approach يلي هو تواصل بين كل الفريق الطبي لحتى نوصل لاحسن النتائج.
Carmen is definitely a success story. She is brave, she is strong, and she likes to keep on moving on. That's a spirit that Carmen has.
So Cleveland Clinic Abu Dhabi, along with its multidisciplinary team, really did help Carmen achieve her activities of daily living and helped her realize that she is able to have a regular life and to be able to complete everything that she wants to. For a 19-year-old, she has her whole life ahead of her, and we were so happy to be able to provide her with that bright future that she deserves.
I am very hopeful that with the treatment that she is getting, she will do wonders. She has done so well in the past few years that I think she has a very bright future ahead, and she will make her parents, herself, very proud.
So I promise her that we'll go back only one more time here for some treatment, and then it will be not necessary to come again because she will be completely cured. With a positive mind, I think this can be achievable.